I must say that you cannot imagine how happy I am to be with you tonight, the Philadelphia fight. It's really with great emotion that I receive this evening this award. This award honors the memory of Kiyoshi, as Jane said, a world-leading activist who devoted his life to social justice. Thanks to him and many others like him, who together have been fighting against HIV, but the fight is far from being over. Over the last decade, we have witnessed exceptional achievement and progress in prevention and treatment of HIV. Recent data shows a drastic reduction in new HIV infection among adults and children, more and more people accessing treatment, and a dramatic decline of AIDS-related deaths globally. All of these good news are the result of sustained progress in scaling up services for the benefit of patients. They are the proof that the huge efforts made by all of you in the fight against HIV are bearing fruit. Despite the advances, more than 6,000 people globally are still infected daily, and under the new WHO treatment guideline, only 34% of people in need have access to treatment. Clearly, we need to do better and to step up the pace, which is the motto, by the way, of the upcoming International AIDS Conference that will take place in July next month in Melbourne. In particular, we all know that stigma and discrimination are still among the key barriers impeding access to prevention, treatment, and care for all. Tolerance and human rights must be respected to end HIV. Many countries in the world experience concentrated epidemics with a prevalence of HIV largely higher in specific population, the so-called key affected population, remains severely underserved in too many settings. Their situation is exacerbated by a combination of social, legal, and economic injustice. These raise barriers and limit their access to the services they need and deserve. Delivering services across the continuum of prevention, treatment, and care for all remain critical to reversal and eradication of HIV. I have the honor, as Louis said, of being the president of the International AIDS Society, the world-leading independent association of HIV professionals. Our goal is to advocate for the implementation of an evidence-based response to HIV and for a concentrated research effort to build that evidence base. One of our priorities is to address the needs of key affected populations who are often the last in line when it comes to benefiting from essential health services. As we said, the IAS priorities co-chair on key affected population is co-chair indeed by Michel Kazachkin, who is now the UN Secretary General Special Envoy on HIV/AIDS for Eastern Europe and Central Asia, and Chris Barre, the Director of the Center for Public Health and Human Rights at Johns Hopkins. Chris, indeed, will, just after me, take over the IAS presidency. Thanks to the leadership of both of them, in relationship with me, they launched the so-called Nobody Left Behind campaign, with the objective to advocate for reduction of stigma and discrimination against key affected population, promote policy and legal reform to ensure universal access to HIV service for key affected population, raise voices and concern of key affected population at the highest, most visible and key international forums. To be frank with you, I'm very concerned with the period we are living today. We observe the resurgence of discriminatory, stigmatizing, criminalizing, and harmful laws in many countries. Many countries refuse to implement harm reduction programs, including needle exchanges and opioid substitution program, for which there is comprehensive, compelling, conclusive, and, despite all attempts to do so, absolutely undeniable evidences that this approach significantly prevents the risk of acquiring HIV amongst injecting drug users. In over 80 countries, there are unacceptable laws that criminalize people on the basis of sexual orientation. Some are threatened of life and prison because they are homosexual. Others are simply killed because of this sexual orientation. That was the case last year in Cameroon. We all need to shout out loud that these violations of basic human rights are just unacceptable. Yes. If you want, as we said, you can join us. You can join us by simply signing the Melbourne Declaration to denounce this law. This declaration has been launched a couple of weeks ago on the website of the 8th 2014 Melbourne Conference. On a more positive note, we are, on the contrary, living a quite exciting period on the scientific point of view. As I was mentioning earlier today, in my lecture, the Jonathan Lack's lecture, we have been observing over the past, let's say, 5 years, a resurgence of optimism regarding the possibility of developing at least a sustainable remission that would allow people living with HIV to permanently control their virus without the need to take daily antiretroviral treatment anymore. Indeed, as most of you probably heard, in 2009, the world met Timothy Brown, the first person ever cured of HIV. Last year, in my country, in France, it has been reported on 14 patients that were treated very early on. and that are able to maintain a permanent control of their HIV infection without taking any more antiretroviral medicine since now 9 years. Very similarly to the US Mississippi baby that you probably heard about, which was corresponding also to a very early treatment. These cases are what we call proof of concepts. Of course, you should not stop your treatment without being part of a research study. It's just a proof of concept today. But these proofs of concept are pivotal in providing impetus to further research and breakthroughs. This is why the International AIDS Society decided to launch in 2010 what we call the Toward an HIV Cure initiative. This initiative I have the pleasure to co-chair with my friend, Franc oise Barre, the director of the Office of AIDS Research at the NIH. This initiative, the goal of this initiative is indeed to mobilize the scientific community and accelerate research on that topic. I must say that I think we have been quite successful in making it a priority in the international HIV science agenda. But once again, the scientists are not working alone in their ivory tower. We work side by side with patients, communities, and it is essential if we want to develop not just a new therapeutic tool, but the therapeutic tools that the people living with HIV themselves would like to have and will use. This is of extreme importance to assess the acceptability, expectation, and preferences for HIV cure-related clinical trials among people living with HIV. For that, we have also set up a dedicated working group that comprises both representatives of patients and social science researchers. Don't ask me when a cure will be available. I do not have the answer. And I can only say that it is going to take time. But it is our responsibility to try to search for one until we find it. The same applies, by the way, for HIV vaccine. We need both tools to end the HIV epidemic. The only certainty that I have is that the more we will be united, the faster we will reach our goal. Thank you very much again.